intermediate core circuit B, so this is the medium level circuit. We have 6 exercises to go through. A couple of these exercises you will see are the same exercises as the previous core circuit, and then I've added some new ones. So those are just to kind of make sure you master a couple of those before we go on to the harder versions. So things you'll need: I have a ball, a towel roll or yoga block works as well. I have a kettlebell, something heavy that you have at home also works, a dumbbell or just some other heavy object you can think of. And then I've got 2 different bands here. You can use the same band, we just need a long resistance band here. So let's go ahead and get started. The first exercise, you're gonna need the band, so anchor it to something sturdy. And then you're gonna lie onto your back. Your knees and hips are gonna be up in a 90-90 position. And we are gonna do heel taps with lateral resistance, meaning that this band is pulling me towards it. Okay, so it's gonna help my core turn on even more to resist that motion. So inhale, exhale, press the band away, don't let it pull you as you tap one heel and the other, okay? And then inhale again, exhale, tap, and tap. Exhale from the bottom up, empty all your air out. Okay, really think of squeezing and lifting the pelvic floor, tightening the lower abs, and then gently bringing that rib cage down. We're gonna go ahead and switch sides here. So I'm just gonna do a little turn around, and we're gonna do the same thing here on the other side. So knees and hips at 90, inhale, exhale. I'm pressing the band away each time and then coming back in. You can also just do the isometric hold and hold this here and just keep a good breathing pattern as you continuously go through the heel taps. Again, don't let those ribs flare or low back arch. We are really firing up the core here with this lateral resistance. If you want to make any exercise harder on you, really add this lateral resistance, and it will really make your abdominals work even harder to keep your trunk and pelvis and core stable. So that is the lateral resistance heel taps. Next, we're going to come onto our hands and knees and do opposite arm, hand, and knee lifts. So these ones, if you've done the exercises in the prior circuit, this one should be familiar. Inhale through your nose, exhale, opposite hand and knee. Now, if this feels super easy to you, you can go to the next level, which is the bird dog, opposite arm, opposite leg. But if you're still thinking that you're making sure your core is engaged properly, then stick with the opposite hand and knee lifts. Keep your neck long. Exhale your air out from the bottom up. Opposite hand and knee lift. Once you get about 6 to 8 reps per side there, we are going to come into a tall kneeling position. So for this, have your band anchored a little bit higher. Wherever you're placing the band, you want it a little bit higher. I'm going to come away from the band. I have the ball between my knees. So we're doing a wood chop. So I am bringing that band down and across as I squeeze the ball, as I exhale. Inhale, come back up, exhale, squeeze the ball, pull down and across. Do one more here. Here we're working our anterior oblique sling, so we're getting our oblique muscles and our adductors, working that anterior oblique sling. I'm going to switch sides, same thing, I'm keeping the ball, we're just doing the opposite side. Okay, so again, inhale, on your exhale, engage the core from the bottom up, squeeze the ball. Okay, once you get about 6 per side there, you can set the ball to the side, grab your chair. I've got a chair, you can also just sit on the couch or an ottoman or whatever you have nearby. So I'm going to sit on the edge of my chair, you're doing lean backs. We're going to stay in the chair. This is a difficult exercise, so I really want you to master this in the chair before you move to the floor. Okay, so we want to make sure our lower abdominals are engaging on our exhale as we lean back. Inhale through your nose. Rib cage expands 360 degrees. Exhale from the bottom up. Lean back and come up. Now is when we might want to start holding for longer. So I'll demonstrate that with the rest of the reps. Inhale through your nose. Exhale. I'm going to hold back here. Inhale. Exhale. Come up. We're going to do one more here. Again, watch for lower belly pooching, doming, or bulging along the linea alba. If you see that, try lifting the pelvic floor to engage those deep abs. Make sure you're exhaling your air from the bottom up. Okay, we really want to make sure we're doing that one properly. We really want to make sure we're getting those deep abs turned on there. Next, we're going to come to a front plank on your chair. So chair, couch, bench, whatever you have. I'm going to come up onto my hands. You can also stay here on your forearms, whatever is more comfortable for you. I'm going to come up onto my hands, keeping a slight bend in my elbows here. And I am just going to take 5 good deep breaths. Inhale. Exhale. And again, this is a position you want to maybe video yourself, see what your core is doing, maybe feel along the linea alba, what's going on. Are you getting, doming or bulging? Do you feel heaviness in your pelvic floor? Those are all things you want to be aware of, especially in front loading positions like this. So planks, push-ups, pull-ups, other exercises like that, those lean backs. We need to load that tissue, but we also want to make sure that you have control over your core and your abdomen, and that you're not just letting it all go and letting the pressure go out at the weakest points. We got to make sure you have control over it using your breath and your core engagement. So once you've done about 5 or 6 breaths there, we are going to rest. And the last exercise we have is a suitcase carry. So you need one heavy weight, or so I have 25 pounds here. You can go heavier or lighter, whatever's heavy for you, or grab, a paint can at home, or a jug of water, or something that you have that's heavy, your car seat with your baby in it. Grab that. That's a great way to do this. And I want you to pick up the weight on one side. You're not letting the weight pull you. You're keeping your trunk upright. Your core is engaged. Breathing through this as you walk. Try to stay upright as you walk. Okay. Walk the length of your room, the length of the basement, a hallway, length of the driveway, whatever you have available to you. I'm just going to walk back and forth so you guys can see me. in the video, but maybe either set a timer, maybe 30 to 45 seconds or a minute on one side, or down and back, the length of the hallway. And then you're going to switch sides, okay? So switch sides, same thing. Always hip hinge to pick that weight up, or squat down. Don't round it too much at your back with that heavy weight. And again, you're breathing through this. Your trunk staying upright here to prevent you from shifting down into that weight. And you're just going to walk in a straight line, kind of shorter steps, but staying upright. So if this starts to feel easy, then find something heavier that you can grab onto. Make sure you're managing that pressure. I don't want you to feel any heaviness, pressure in the vaginal area. I don't want you to leak any urine. If you have any of those symptoms, then we're going to want to make sure we modify, either go lighter in weight, make sure you're breathing, engaging your core. And then if you still have symptoms, then we want to make sure you go in and get an assessment from a pelvic floor therapist so we can figure out what is going on, because those things are common, but they are not normal. So those are your 6 exercises in the intermediate core circuit B, the medium level difficulty. Again, check out the individual videos that I have also, where I dive deeper into tips for proper form and go over a little bit more in detail of each exercise. So check those out. Make sure you've mastered these exercises. Repeat this once you go through each exercise. Maybe do 2 to 3 rounds total. So you can always press replay here on the circuit and give it another go.